Most ENT hides this, and that's why you can't breathe well. My husband said I'm like the woman he married again. This is what your sinus passages look like when you have chronic inflammation. You want to take your sinuses from this to this. Neti pots? I used one every single morning for 2 years. Sure, it clears out the mucus for maybe an hour, but then everything comes right back. The congestion returns worse than before. You're back to mouth breathing at night and waking up exhausted every morning because you're not fixing what's causing the blockage in the first place. What about decongestants and steroid sprays? I have a drawer full of them. Pills, sprays, inhalers. They work for a day, maybe 2, then your nose is blocked again because they're just covering up the problem, not stopping it. And surgery? Yeah, I already did that 18 months ago. They promised it would fix everything. It didn't. Within 6 months, the blockage came back worse than before. I couldn't bend down to tie my shoes without my face feeling like it was going to explode. Every time I leaned forward, the pressure was so intense I'd have to stop and wait for it to pass. And my doctor just shrugged and said, sometimes that happens. So how did I finally breathe clearly after 7 years? It's all her fault. Yeah, her. She's the one showing people how to break the inflammatory cycle at home in just 6 minutes a day. Watch this. Look, I'm a woman who couldn't breathe through my nose for years, and I kept blaming it on allergies, and I blamed it on the weather, and then my immune system, but none of that made sense. At first, my husband said it was just seasonal and it would pass, but I was mortified. And the worst part was waking up every single night gasping for air with this crushing pressure across my face and feeling completely exhausted, no matter how much I slept. I was drinking coffee all day just to function, so when I tell you I tried absolutely everything, I did. 4 different ENT doctors, 3 rounds of antibiotics, steroid sprays that made my nose bleed, allergy shots for 8 months. And then I finally agreed to surgery. They cut into my sinuses, removed tissue, promised I'd be fixed. For a few months, I could breathe a little better. Then it all came back. The blockage, the pressure, the exhaustion, everything. And it wasn't just affecting me anymore. I couldn't make plans with friends because I never knew when I'd feel too awful to go out. I'd cancel dinners, skip events, make excuses. My whole life started shrinking because I was too exhausted and congested to do anything. Even simple things like going to the grocery store felt overwhelming because the facial pressure was so intense. That's when I knew I was losing my life to this thing and nobody understood. So I made one more appointment with a specialist I'd never seen before, just hoping for anything different. Dr. Anderson, one of the top ENT specialists in the country. He'd treated thousands of chronic sinusitis cases over his 20-year career. And what he told me finally made everything make sense. He explained that the real problem with chronic sinusitis isn't just the blockage, it's inflammation. Look, when your sinuses get inflamed, they swell up and block the passages. And when the passages are blocked, oxygen can't get through. Here's where it gets bad. Without enough oxygen, your body creates even more inflammation. So the inflammation creates the blockage starves your tissues of oxygen, and that lack of oxygen triggers more inflammation. And the pressure in your face gets worse. The headaches get more intense. The exhaustion becomes unbearable. It's like an endless cycle, over and over. That's why none of the rinses or antibiotics or steroid sprays ever worked. The doctor showed me my CT scan and pointed at all the gray, cloudy areas. That was pure inflammation, completely blocking everything, which means treating the symptoms does nothing to fix what's actually causing the problem. So no wonder nothing I tried lasted more than a few days, even after spending thousands of dollars over 7 years. And he warned me that most people just live with this. But if I kept ignoring it, the chronic inflammation would cause permanent damage. The tissues would get scarred from all the swelling, the blockage would get worse and harder to reverse, and eventually I'd need multiple surgeries that still wouldn't fix the inflammation problem. I definitely didn't want that. That's when he mentioned red light therapy instead. It delivers a specific type of light directly into your sinus passages. What makes this different is it uses the exact wavelength that's been proven to reduce inflammation in sinus tissue. It's called 660 nanometers. You can use it while watching TV or reading. It's incredibly easy. You just insert the soft tip into your nostril, press the button, and relax for 6 minutes. It's so comfortable I'd forget it was even there. I use it while I'm watching my favorite show or while I'm making dinner. I got used to the routine in about 2 days. And the best part, I can actually make plans again. I went to dinner with friends last week. I didn't cancel. I didn't make excuses. I just went. And I felt good the whole time. It feels incredible to have my life back. And I'm not the only one. There are thousands of men and women sharing their success stories.
I have a clear nose. I'm sneezing less. Yeah, it's incredible.